The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. And we're back on Meet the Doctor. My guest today on this beautiful Monday afternoon is Dr. John Burns, and he's a plastic surgeon in Dallas. He's the president of the Dallas Plastic Surgery Institute, which has 10 plastic surgeons in it. Not quite as many as a building in New York City, but close. Welcome to the podcast today.
Thank you. Glad to be here.
So, what is it like being in the same space with 9 of your colleagues every day?
It's surprisingly easy. We all have our different niche interests. We all sort of have offices that are a bit separated. So if you're from the 80s or 90s, you may have watched a show called Melrose Place.
I did watch that.
Everybody kind of lived in the apartment and kind of interacted. It kind of reminds me of that. But we have some shared things we do. We have a surgery center where we see each other and the skincare center and that kind of thing. But pretty much we leave each other alone and that seems to work.
Do you see any benefits to having that many smart people around you every day?
Definitely. Yeah. I think that when you hang out with smart people, we're always talking about cases. We're talking about, our patients, not to violate HIPAA, but just to say, I saw this lady and she had this or that, and bouncing ideas off each other. We have a journal club once a month. We have a fellowship. A fellowship is where plastic surgeons who've done their residency come and spend an additional year learning about cosmetic surgery. So we have a journal club every month, and that's where we can really get into the nitty-gritty of the different things we're doing and share ideas. So it's great. The other thing is, I think it's the opposite of feeling isolated. I think sometimes plastic surgeons are by themselves, and the only opportunity they have is national meetings or a local meeting with the Dallas Society of Plastic Surgeons. I'm sure there's an Austin, Society of Plastic Surgeons, but those meetings are few and far between. So it's nice to have help. It's nice to have people in town when you travel that are competent and you trust your patients. So all in all, it's a good trade-off.
I imagine that academic focus and the learning part of going to work every day is probably pretty fun.
It really is. I think that's what a lot of doctors miss once they graduate from the residency. Nobody loves the residency. It's kind of like, a military type experience. But I think we all, as time passes, look back on those years fondly because you kind of went through a lot. You learned a lot. And as, you get older, things can get a little stale. So at least here with our fellows, you're seeing a constant turning over of new minds, new ideas, and it keeps it fresh. It's really one of the things I love most about the practice. Mm-hmm. It really is a way where we can interact with each other and then the younger doctors. It's very academic in nature. One of my partners was the chairman at UT Southwestern for years, Dr. Rorick. And so he's been real great. He was the editor of our journal. So there's a lot of expectation to do research and to publish and write books and that kind of thing. And we all want to participate in those processes.
Now, when the fellows come to you and it's their first day, that's not the first time they've ever done plastic surgery, is it?
No, they've done a residency in plastic surgery. So they're fully trained. A fellowship is an additional year. So you can do a fellowship in hand surgery. You can do a fellowship in microsurgery and breast. A lot of people do that. You can do a fellowship in craniofacial. And you can do a fellowship in what we do, which is aesthetic or cosmetic surgery. So you can imagine if you've trained in a sort of a city hospital, a public hospital, your exposure to cosmetic surgery has been somewhat, it's not been great. And so they come here and learn the finer points of cosmetic surgery. So,
how many fellows do you have every year?
We have 2, and they come from all over the country.
I bet that's competitive process to get the fellowship at DPSI.
It is, yeah. There's not very many of them, and I think we have a great opportunity. So it is.
Yeah, that's really neat. So are you the second biggest plastic surgery practice in America?
That number changes a lot. At one point, they had one in Charlotte that was pretty good size, and there was one in Long Island that was a good size.
I think Long Island has 30 now.
Is it 30? So
I think so.
there's also this rolling up of practices that's occurring with private equity. So you have private equity buying smaller practices and rolling them up. So it's a really good question. I don't have the answer to it, but I would say we are one of the biggest.
Mm-hmm. And you also have a pretty sizable med spa. How many people work there?
Yeah, so we have about 25 employees in our med spa. So we have 6 or 8 nurse injectors that do Botox fillers. We have about the same number of estheticians, and then we have a lot of support staff. It's a really big med spa.
And there's a pretty heavy technology component in your med spa, isn't there?
Definitely, with lasers. And so we look at that constantly, month over month. But there's always something new, and it's our job to sort of evaluate and in that newness, what's effective and then what's just marketing.
Can you think of, kind of the core services in the med spa and give us a flavor of what's on the menu?
Absolutely. So it's kind of a lot of a med spa is going to be skincare. And so we've made a commitment to only do medical-based skincare. So popular products we carry are Zeo, Elastin, Skin Medica. Those are our big lines. So skincare is a big part of, skin analysis. So you come in as a patient and we'll take a photo of your face, talk to you about, your goals, ask you some questions, just basic questions. How much do you want to spend, this and that, and come up with a plan. So there's a laser technology component of skincare where 25-year-olds don't need the same services as somebody in their 40s who doesn't need the same service as somebody in their 60s. Face and neck is the big one. And then we also have things you can do for your body as well. The third thing we do at the med spa a lot is Botox and fillers. So Botox is the muscle relaxer that we inject into the upper third of the face, and that takes care of wrinkles. There's other uses for Botox as well. And then the fillers are gelatinous substances that we inject in certain parts of the face to plump the face. It's an anti-aging, anti-wrinkle thing. So big part.
So there's new technology and there's new products coming out all the time. Seems like the next new thing is always like the next hashtag that we have to remember.
Yeah.
And curious how, as a group, you assess and decide what you're going to bring into the med spa.
When I was finishing my training, I really didn't have a good grasp of how to evaluate that. So I did a fellowship in lasers. And so that's why I feel like I'm uniquely suited to run the EpiCentre. But there's just so much to learn. You have to go back and understand the physics of what's happening. So everybody wants to sell you their machine. And for me, the first step is, does it make sense on a physical level? Like, is that laser properly designed to treat what it is that we're treating? The second thing is what the FDA does is look at efficacy and side effects. And so you want to find a device that has a high efficacy and a low side effect profile. And we like to be the innovators and the first on the block. But doing that, you have to be very careful. And so after you've been in the business for a while, you sort of know who you can trust and know who's not been around very long. And so some of the devices, I'll brag on a company I like a lot called Cyton. They make an excellent laser. And so sometimes when we get busy with these devices, we have, a lot of patients. And so we'll buy 2, 3, and sometimes even 4 of the lasers because they work well. And then sometimes we'll invest in something and it doesn't take off like we thought.
Just from the patient side of that, I know you're not wrong because I've been getting BBLs for years. And then here came the BBL Hero. And I could tell this was a significant improvement because of not just the technology, but the speed, because who wants to have a longer laser treatment? Like nobody wants that.
It's been a real game changer, the BBL Hero. So Hero doesn't mean it's great, although it is. It actually stands for high energy rapid output. So what used to take a long time can be done very quickly, which is great for the patients. It also allows you to treat a lot of different areas. You can do your neck, your chest, your arms, your legs, treat the whole body very quickly. And what's funny is when they made the laser, they actually put another laser with it that was supposed to be sort of the stepchild of that box. And it was called Moxie. And so
I've had that too.
You've had that too? Yeah. So the Moxie was supposed to be just sort of a nice little add-on, but I don't think Sciton realized what they had because it is so effective and works so well that I have a hard time sometimes thinking about if I had to choose between the BBL Hero or the Moxie, which I would pick because the Moxie is so great. So that's an example of a laser, I'm glad you brought it up, that works so well that we kept buying more.
It's a good thing you don't have to choose. You can totally have them both.
Yeah, we actually have 4 of the devices because the patients want it.
And are they busy all day long, aren't they?
All day long.
Yeah. It's always nice to hear that when you have a favorite then you talk to a doctor and it's their favorite too, because it means
it validates, definitely. Yeah. You have good taste.
Yeah.
So,
and I have a great provider too.
Good. The other one that's really, I think, has been great for us recently is something called SoftWave. So it's sort of a modern version of Ulthera. And so it uses ultrasound in a specific way. It's less painful, and it's designed to tighten tissue. So it works really well in those patients who are 35 to 50 that have some laxity to the soft tissue of their face, but aren't quite ready for a facelift.
And that works on other body parts too, doesn't it?
It does. Arms, loose skin, anywhere really.
Oh, you said arms. That's like the magic word if you're of a certain age.
I've noticed that women like their arms, so I've gotten to appreciate that. Nice arms.
Right now I'm on the make my biceps bigger plan so that the bottom doesn't look
that works too. Yeah.
I can imagine that you just have so much fun with these. I mean, they kind of feel like toys because you can do really cool things with them, but you're also making people's lives better in a way that is not insignificant.
Yeah, it's a lot of fun, and there's a lot of interaction with the companies. We interact a lot with the reps who are, for the most part, very interesting people. And then the ability to, like you said, give patients sort of an option besides surgery. Plastic surgery is just not the operating room. There's a whole area that we can use for people that might not necessarily be ready for surgery, or maybe they're sick and they're not good candidates for surgery and they can come in, they don't have to get put to sleep. We can do these things and they can get a result and make their life get that done.
What might somebody expect the first time they come to see you especially if they've never been to a plastic surgeon before?
Great question. We live in a day and age where people are exposed like they've never been before. There's a lot of behind the scenes stuff on TikTok and Instagram and what used to be Twitter. We call it, I guess it's X now. And all the social media platforms, it's changed the game. So patients are more educated and they're more aware. So when they come in for a breast augmentation, for example, they've probably been on social media and they've probably seen the procedure done. So my consults used to be more sort of, this is what happens, blah, blah, blah. And now it's more drilling down to a deeper level with the patient. And the discussion now is much more advanced than it used to be, which is nice. I mean, I really enjoy that. To your question, though, there are patients that come in and they say, I just look older, or what do I do with my body? I've been on Ozempic and I have all these things that have happened with weight loss, or I had a baby and my body changed and what can I do? So we get a lot of that too. And I think the most important thing as a doctor, plastic surgeon, is before we get into our spiel. And because in my mind, I sort of kind of know what to do, within a few minutes. I think it's really important before I start talking to listen to the patient, because a lot of times what I think is not necessarily what they think. And both our lives will be infinitely better if I just shut my mouth and listen. And it may be that their stomach is not bothering them at all. And it may be just the breast. And I'm focused on the stomach or the abdomen. And, the conversation doesn't go well, or the patient feels like they're being talked into something they don't want. So the first thing I always try to do is listen and hear the patient, figure out what it is, and then from there, put our heads together and come up with a plan. Because I think everybody, when they walk into an office, it's a pretty simple thing to say, what's bothering you? Why are you here? And as stupid as that sounds, it actually is the most important question.
How much time do you usually give people for an appointment like this?
It really depends. So, a facelift consult would run a little bit longer than maybe a breast augmentation consult. But we try to do a new patient consult, and then we'll see some patients that we've operated on. And we don't ever try to crowd the new patient consults too close together, because I don't want anybody waiting, and right. I want them to get as much time as they need. So those consults can take anywhere from 30 minutes to an hour.
Yeah. I used to survey patients for a living, and I learned at that time that they're just as upset with being rushed as they are with waiting.
Yeah, I think that's very, very, very true. I think that they want to be heard and they want their questions answered. And I sort of try to put myself in their place. This is elective. They don't have to be there. And it's expensive. And so you owe it to them to spend the time. And I think at some point, you get to a point where the questions are answered, we have a plan, and at that point, I think it's done.
Do you ever find that the social media and this sort of onslaught of all the information, and a lot of it is conflicting, what you find online, that people are just really wanting you to be their North Star and tell them that actual truth and not just,
Yeah, it's the Wild West. And I think that most people have an internal radar. I'll just say I have three sisters, a mom and a wife. So I'm around women all day. And I think that's probably something that women are better at than men, is sort of that sixth sense. Mm-hmm. And so I know in social media, there's been a big push for sort of marketing. And so with marketing, how do you differentiate? Like, why are you better than this other guy? And so that's kind of created this whole category of like euphemisms or cute little terms, vertical. There's all sorts of ways that we can describe a facelift that sound sexier or somehow more specialized. And I think that would be one red flag, is anybody who has this sort of magical trademarked procedure. We all do things differently, but we all do things pretty much the same. And I think that people that say, I'm the only one that can do this, that's not true. So if you're truly a master at your craft, you ought to be able to teach that to a board certified plastic surgeon. And they ought to be able to reproduce at least closely to what you're doing, because we're all about the same level of intelligence. So I think that in marketing, the other thing I see a lot of that I would just caution is photography. It can be manipulated very easily. So, when you look at photography, I think it's important. Standardized views. We all have pictures of our patients. They send us, they're in their car, they have their sunglasses on, they got a neck lift, but they're not looking down, they're looking up, and the neck looks great because you're not getting a true sense of the picture. So I think that if I were a patient trying to wade my way through the mass of, the internet, I would try to find standardized photography where the patient looks exactly the same in the before and after in terms of their, the lighting, the positioning. Patients should not wear makeup in their post-operative pictures because that hides a lot. So those are just some tips to kind of navigate the social media. The other thing that I think has been a real issue, at least for me, and I'm sure there's this thing on the other platforms, but these chat rooms or
the secret Facebook groups.
Facebook groups or things like that where patients sort of give medical advice and they say, well, you need to do this or you need to do that. And I think that's a definite red flag. And that's been hard for us because patients will come in and say, well, my friend said that you don't need a drain for a tummy tuck because her doctor doesn't do this or that. And it creates sort of a very confrontational. So I would just say, if you decide on the physician, go ahead and go all the way with that doctor because they know what they're doing.
Mm-hmm.
And, when you get on the Facebook groups, it can get kind of out of control.
It is a little nuts. And you can join a Facebook group. Then you can find an opposite group that disagrees. And so you can actually find the breast implants, for instance, that I got mine out and I regret it. I got mine out and I regret it. And I put them back in and I got mine out. It just goes on and on and on.
Right. Exactly.
Your photos are really well organized and really beautiful. And in a way, what I love about your photo gallery, just looking at it, as someone who's looked at probably thousands of photo galleries in my lifetime, I really like that I don't have to click anywhere to see the pictures. I can just keep going and going and going. And it's not a lot of work for me. So thank you for doing that.
Well, I appreciate that. I do have some help. Mm-hmm. I have a lady who's fabulous named Jessica that organizes those for me because it does take a lot of time.
Yeah.
And I think more than anything, accolades, this and that, I think you're 100% right that when you decide on a doctor, just make sure that their work that they put out there is matching your expectations. And if it's not, that's okay.
Sometimes I get asked, how many photos should they have? Or sometimes doctors will ask me, how many photos should I have? And my answer is always, too many to count.
Yeah.
If I can count them, especially if I can count them on one screen, that tells me something that is, maybe you just didn't put them all up there because you're busy, but then you can ask in the office, do you have more photos that I can see? And if they say yes, and there's like 200 more that you can look at in the office, that's great.
Great point. I think that some patients don't want to share the photos, but I think enough patients are willing to share photos. And I thank all my patients who've done that for me because I think that that is the most important thing. So it's been something that I think some of the more established doctors did not do and didn't have to do. But I think that's the world that we live in. And so I think that sometimes patients might get some pushback from a doctor and say, well, that's just not something we do in this office. But I think that that's really not a fair response in this day and age. The other thing I think, if you're looking for a great way to choose someone, is the personal referral. Do you have a friend that has seen this doctor and what did they think? And I think more than anything, probably in my practice at least, the internet's what it is, social media is what it is, but more than anything, most of my patients are word of mouth.
Yeah. What a compliment. Now, you're a Texan. Were you born in Texas?
I was, Dallas.
You were born in Dallas. You went to high school in Dallas. Go Scots. No.
Go Scots.
And then you kind of stayed in Texas for school with maybe just one exception.
I went to Vanderbilt. So I loved Nashville and had a great time in Nashville. And then I came back here. I went to UTMB in Galveston and then trained there for plastic surgery. And then I did a craniofacial and aesthetic fellowship in Dallas, so at Southwestern.
I've always wondered what the patients are like who come to UTMB Galveston for plastic surgery. And I've wondered this because when I lived in Houston, one of my best friends went down there and had a platysmoplasty done by a student. And it didn't go perfectly, but she still came through it and looked great, still looks great to this day. And that was probably 15 years ago.
Yeah.
So aside from her, what kinds of people end up having surgery there? What does that look like?
It's like any other big place, Parkland in Dallas or Ben Taub in Houston or Herman, UT Houston. patients go to teaching institutions primarily because they're less expensive. And so that's why the training, at least in cosmetic surgery, is somewhat limited. So we all face that hurdle. And that's why we have the fellowship. So doctors that have an interest in doing aesthetic surgery can come here. And we have a clinic here. That's the aesthetic clinic. And patients get a discounted price for going to the fellow clinic.
So at UTMB, are they seeing also like breast cancer kinds of cases?
Yeah.
They're doing reconstruction, they're fixing trauma, that kind of plastic surgery that's not aesthetic?
Right. Plastic surgery, people see it mostly on the internet as being a cosmetic specialty, but that's actually pretty narrow part of the whole plastic surgery. So plastic surgeons do everything. They do a lot of reconstruction. So that's sort of the fundamental, the specialty is reconstructive in nature, meaning somebody takes it apart. They take out cancer, take off a breast, they make a defect, and then the plastic surgeons come in and they sort of reconstruct it. And in that vein, there's a lot of trauma that goes into it, head and neck trauma, broken bones, burns, pediatric plastic surgery, which is cleft lip and palate, but also any type of congenital deformity we typically treat. There's hand surgery, so that's a big part of it as well. So it's a lot to learn in 5 or 6 years. So the aesthetic stuff a lot of times gets sort of swept under the carpet.
Yep. You really can do everything. But one time someone told me his worst fear was being the only doctor on an airplane when they pushed the button and needed a doctor.
That's happened to me more than a few times. So I always wait and make sure there's...
Do you all go in the back and go, rock, paper, scissors?
Right. There's a joke that, what do you call two plastic surgeons reading an EKG?
What?
It's a double-blind study. So, yeah, we're great at surgery, but we're not heart doctors for sure. So, but I have been on airplanes and taken care of people, and it's been interesting, but it worked. So,
have you ever had to deliver a baby?
Not a baby, thank goodness. I think I could do it, but a heart attack and an anxious woman who was freaking out. So I went to the back and I dug through their medicine cabinet and we gave her enough Xanax to get to our destination.
What do you tell people when you're on a plane and they ask you, what do you do for a living?
It's interesting. I have not had that question in a long, long time. I have 3 kids, and when we travel, it's a lot of backpacks and
dad mode,
a lot of headphones. And I'm usually sitting between 2 kids. But there was a time when I was working on a talk. I do a lot of speaking at meetings, and this guy leaned over, and for me, I just don't even hardly think about it, that I was putting together some pictures of breasts that I had done. And to me, that's just sort of like my thing, I'm the breast guy. But he said, what are you doing? And I looked at him and I was like, oh, I probably shouldn't do this on the airplane. And he laughed. And I'm glad it was him and not some kid. But anyway.
In one of my jobs, I did all the before and after photo editing. Yeah. And I was doing them on planes all the time because you could do that. You don't
think about it because it's just what you do. And it doesn't look like a body part at some point. It just looks like it's the background the same and there's the lighting the same. And,
Last week I was editing a course that had about 15 labiaplasty slides in it.
Oh, gosh. Yeah. That'll get your attention.
At home even. And I have a shortcut on my computer that hides everything on my screen if I go to the shortcut. And my kids and my husband kept coming in. And I was like,
you were hitting the shortcut. Oh,
sorry.
Yeah.
Mostly because I don't want them to have to see it. It's not, they know what I'm doing, but.
I do. That's cute.
Yeah, it's like, Mom, what is that?
Oh, mercy.
Yeah. I learn a lot every day, and I'm so grateful for what I get to do because it's so much fun.
That's amazing.
Yeah. And I get to talk to great doctors, and it couldn't be better. Like it's been a really great, I think you might be the 115th episode of Meet the Doctor.
That's amazing. Congratulations.
Thank you. It's been wonderful. I'm really glad that you joined us. So before we wrap it up, I have to ask about the medals. It looks like you're a distance runner because I see a New York City Marathon medal.
Oh, yeah. So I love to run. That's kind of my happy place. And so they go all around my office. And I had them at my house, and my wife was tired of them. And she said, "You have to take those to the office because I'm tired of looking at them." But almost everyone is either New York Marathon or Boston. Those are my two favorites. So I have some other ones thrown in there, but every year, November, I run the New York Marathon, and every April, I run the Boston Marathon.
So are you in a perpetual state of training?
Always training.
Yeah.
But I love it. People are like, "Gosh, I can't believe you do that." But I can't imagine getting out of bed and not running, if that makes sense.
So you run in the morning?
And in the afternoon.
And the afternoon. In the summer even?
When it gets really hot in Dallas, we call it the dread mill, but I will go to the gym where it's air conditioned to get on the treadmill. And I'll do that because it doesn't get cool till like 9 o'clock, as you know, living in Austin.
I do.
But I'll get up in the mornings, at 5, and it's still, even in August, it's not too bad. So, yeah, that's just my thing.
Well, you'll have to come run Austin sometime.
I love to run in Austin. I love to run around Town Lake. And they've got it now where you can go all the way past the 6th Avenue Bridge or whatever, and there's a 10-mile loop now that you can do. So
I've never done it, but I have heard about it.
Yeah, it's a great run. It is really fun.
If someone's listening today and they're interested in finding out more about you, where should they go look for you online?
My website, it's drjohnburns.com. And then I have a big Instagram presence. Again, Dr. John Burns on Instagram. And then we do TikToks, which I find to be hilarious. So half our TikToks are funny. So if you want to laugh, go to our TikTok page.
I definitely will do that. Thank you.
Yes.
Thank you for sharing so much of yourself with us today. It was a pleasure getting to know you.
That was fun. Thank you so much.
You're so welcome.
Yeah, appreciate it.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, THEAXIS.io.